Today I'm going to discuss about a very important topic, that is a breath holding spell. Breath holding spell is basically episode of apnea and loss of consciousness, right? So this is divided into the two subtypes, cyanotic subtype and pallid subtype. So in cyanotic subtype, so it is provoked by crying, right? So episode of breath holding, and then it will lead to the cyanosis, right? And this cyanosis ultimately lead to the loss of consciousness, right? So, so after this episode, the rapid return to the baseline in cyanotic subtype, where the pallid subtype is basically provoked by minor injury. So it is provoked by minor injury, right? So episode of again breath holding, and it will lead to the pallorness of skin and sweating, and this thing ultimately lead to the loss of consciousness. So after the episode, there is a confusion and sleepiness in case of pallid subtype. So the risk factor for the breath holding spells are family history. One, age is one of the risk factors, 6 months to 2 years. And the very high yield one is iron deficiency anemia. So the iron deficiency anemia is highly associated with the breath holding spell. Now I'm going to discuss about the investigation. So the most important investigation is CBC and iron study. CBC and iron study, while the treatment of the breath holding spell is reassurance, very high yield. Reassurance is very high yield. So iron supplementation if deficient, and resolution by age 5.